Urinary problems in women. This is something which is very common. Women are very tolerant and they never disclose it to anybody. They try to cope up with it as much as possible. So what are the problems? Repeated urinary infections can happen, and it's important to treat it because all you need is to do an ultrasound, urine examination, culture. You do an ultrasound because you want to know why repeated infections are happening, and if there is any sugars, treat it. So these are all very important. See the extent of infection by doing, CRP level, and if the infection is really high, treat it effectively because repeated urinary infections may be detrimental to the kidney. So you have to be very careful with that. Now the second thing is leaking of urine, urinary incontinence. And stress incontinence, where patients leak urine when they cough, laugh or sneeze, is very, very common in women, particularly when they're getting close to menopause. So this is something which they don't disclose. But in early stages, all you need to do is a pelvic floor exercise. And it's something which you can do at home. And it's very important to tell people that if they keep on repeating the exercises, at least 30-40% of them get relief from this. And medication is also available, and this can be given. Only when it reaches a very bad stage, the patient has to use continence, pad. All the time they have to use a panty with a continence pad. Then it becomes difficult and therefore they have to have surgery. Otherwise, recognize it early, you encourage exercises, and then it can be treated.